And just kidding about the live stream. That is an option that is not functioning very well for us right now. So we're just going to record and we'll share this with folks afterwards. But for the sake of time and to make sure that we are on time for our own presentation, let's just go ahead and get started. Chris, I just saw that you joined us. Thank you so much for being with here with us at Legal Voice today for our Washington State Legislative Debrief. Yeah, we're just gonna roll right into it. Good afternoon, everyone. My name is Jennifer Martinez. My pronouns are she, hers, and Aya. And I am the Senior Communications and Marketing Manager here at Legal Voice. I am coming to you today from the place called Lacey, Washington, but it is also the ancestral lands of the Nisqually, the Cowlitz, the Cayuse, Umatilla, and Walla Walla peoples. And I encourage everyone to introduce themselves in the chat as well, and to please share what Indigenous lands you are coming from here today. And if you don't know what lands or what ancestral Indigenous lands you are on, you can find out at nativeland.ca. It's really important to acknowledge those unceded territories on which we reside, on which we work, on which we live. And another way that you can pay homage and honor the lands that we are on is to consider paying real rent to the Duwamish people, which are the lands that our Seattle office is based on. You can do that at the website that I am posting in the link. This is just to compensate the Duwamish peoples for their land, their resources, and their livelihood, which they have not been fairly compensated for at all, not even close. And yet we thrive on these lands that were unfairly taken. And so just wanted to make sure we acknowledge that here at the very beginning. Next, right before we launch into the nitty-gritty of today's legislative debrief, I want to take a moment to introduce my colleagues that you see here on the screen. First, I'll introduce Alizeh Bhojani. She is our Washington State Policy Counsel here for Legal Voice. And next is Yvette Maganya, and she is our Community Relations Liaison and Lobbyist in the legislature. And with that, I'm going to pass over the presentation to them. Thank you.
Thank you so much, Jen. Yvette and I are coming to you from our Legal Voice offices in downtown Seattle. There is a party happening in the street right outside the office. So if you hear background music, Yvette and I are not the ones having a lot of fun. It's the folks out there. Let us know if you have any trouble hearing us. So thank you again for joining us on this beautiful Thursday evening. If you're in the Seattle area, I know how hard it is to be inside when you could be having a picnic outside. So thank you so much for being with us and hearing about what's been happening this session. Today, we're going to go through some of our legislative priorities this session, our key wins, key challenges, and what we see next, and how we hope to see all of you be involved. Could we have the next slide, please, Jen? This is all of us. Jen did a wonderful introduction. This slide just goes through a lot of our legislative priorities this session. One of the exciting things about Washington State this year has been that it was an opportunity for us to be proactive for bodily autonomy. Both abortion, gender affirming care, we had the opportunity to really push the envelope and do some innovative things despite a really hostile national atmosphere. Yvette and I both started as new staffers in December, and so we hit the ground running with all of these different bills for the legislative session. We jumped into an already set agenda, and this year in particular, our legislators were very, very determined to do something because of the Dobbs decision of last June. They wanted to ensure that Washington State was a protected state with as many opportunities for providers and patients to feel taken care of and protected seeking care in Washington. So we're going to go through all of these different bills and talk about their impact and some of the key wins and challenges this session. And we also just want to flag that we are very, very dedicated to fighting for bodily autonomy, particularly with a Supreme Court that has demonstrated a complete disregard for reproductive rights and autonomy. That is very important that these sorts of protections be in place in Washington. So next slide, Jen, please. So two of our main bills that we worked hard on were the SHIELD law, which was prime sponsored by Representative Hansen in the House and Senator Trudeau in the Senate. It ensures that those providing abortion and gender affirming healthcare in Washington state are protected from out-of-state lawsuits. Once again, this bill or this law only protects folks who are in Washington providing care in Washington for activities based in Washington state. The SHIELD law does not extend if you are physically in Idaho providing care. If you go outside of Washington state, then you are subject to that state's law. We are seeing bans on gender affirming care and abortion care throughout the country, resulting in people from banned states coming to access states like Washington for care. So this bill ensures that our providers in Washington are protected and are able to provide care without fear. The second bill I want to flag is My Health, My Data. This one was sponsored by Representative Slatter in the House and Senator Dingra in the Senate. This ensures that consumers know what is happening with their private health data, including location information. This is particularly important if you use any apps like period trackers or other things that are not compliant with HIPAA, but are collecting personal health information. We live in a world where technology far outstrips regulation and legislation, and My Health, My Data ensures that come May and June of 2024, when you use an app, you will have to go through an affirmative consent process that is more than just checking a box. You have to understand what the company has to tell you what they are doing with your information, who they're selling it to, and for what purposes. And you would have protections under the Consumer Protection Act in case you have not given your permission for your information to be sold and it causes harm to your life. So My Health, My Data is fairly innovative as well, and along with the SHIELD law is part of a very strong protective package, both for people providing care and for folks seeking care in Washington state. I'm going to pass it over to Yvette.
Thank you, Alizeh. In addition to all of the bills that Alizeh just mentioned, we also worked on 3 other bills alongside our partners in the Reproductive Health Coalition regarding protecting patients. So you'll see them on the slide. The first one was Senate Bill 5242, which was $0 cost sharing, which practically just means no copay for abortions. And as we know, cost sharing reduces access to care, particularly for those who already face significant barriers to healthcare. And so this bill would limit out-of-pocket costs for patients, including prohibiting copays for abortion, ultimately making it more affordable. The second bill that you see here on this list is House Bill 1340, which was regarding provider licensing. And so this was legislation prohibiting medical licensure boards from taking adverse actions against providers. As we've seen in the aftermath of Dobbs, many states have banned abortion care, and providers in these states, providers in the red states may face discipline or lose their professional licenses for providing care. And so to sum it up, what this bill does is it ensures that Washington abortion providers and gender affirming care providers as well do not have their Washington state licenses negatively impacted or face discipline if they face adverse action in hostile states, from hostile states. And then the third bill here on the list is the Keep Our Care Act, Senate Bill 5241 from Senator Emily Randall. And the Keep Our Care Act bill aims to address the issue of unchecked health system mergers, so hospital mergers. And this was our 3rd year introducing this legislation. Unfortunately, it did not make it to the floor for a full vote, but we are proud of just how far in the process it got. and how much other engagement we were able to achieve, community engagement, stakeholdering, and it was primarily led by Pro-Choice Washington. So next slide, please, Jen. Okay, so the next slide that is up, this was our big reproductive freedom advocacy day at the Capitol. You'll see in this photo, we have the Attorney General, Bob Ferguson. We have sponsors from the 5 different packages of bill, Representative Mena, Trudeau, Emily Randall. We have activists and providers that were turned out by Pro-Choice Washington. And then the very last photo is all of our staff at Legal Voice from our Washington team. And so, yeah, this day we were able to have all 5 gender affirming and reproductive rights bills heard in their committees, featuring powerful testimony from all across the state, also from providers, also from patients. And then we had 6 lawmakers who spoke during the rally that represented roughly 70% of the state's population. Just another shout out for Attorney General Bob Ferguson, because he really is amazing. And then one of our other priorities that wasn't included in the reproductive freedom package was around the Health Equity for Immigrants campaign. And so this past session, this current session that we just wrapped up, advocates like the Washington Immigrant Solidarity Network, the ACLU, Northwest Health Law Advocates, Columbia Legal Services, and many other impacted individuals secured funding for healthcare access in the biennial budget, so our 2-year budget, through the Cascade Care Exchange Program. And also a big goal of the campaign was to get a Medicaid-like program that would be accessible to undocumented immigrants in Washington state. And so we were able to get some potential funding through this year's budget, and it was such a significant step towards equity. What this funding will do and what it means is that undocumented immigrants will be able to access the care they need, avoid poor health outcomes, preventable hospitalization, premature deaths, receive dental care, cancer treatment, and so forth. Basic needs that our community is so far behind on. And so the goal of this campaign was to continue to build upon the partial funding. The goal of this campaign moving forward is to build upon the partial funding that we were able to secure this year for future sessions, and to do intensive community engagement work this summer, this fall, and going into 2024, as well as just to track how this will be implemented. So just for the final budget, what it included, there's 4 primary areas. So the first one was $110 million to continue funding for the Exchange's Cascade Care Savings Program, some of which will be available to undocumented immigrants under 250% of the federal poverty level. So that will begin January 2023. The second part of that funding was $49.5 million for the new Medicaid-like program for undocumented immigrants who are under 138% of the federal poverty level, which will start July 2024. Next is $7.7 million in new funds to increase the limited number of low-income immigrants eligible for that long-term care support, which is really, really important. And then last but not least, $3.7 million in new funds to support outreach, customer service, administrative needs for the new program, including a study on how to improve the Cascade Care affordability through further the 1332 waiver. And so again, we were able to secure partial funding this year. We'll continue to work on it during the summer, the interim, and hopefully also secure other wins going into 2024.
Thank you, Yvette. Thank you, Jen. So some of the key wins we want to highlight for y'all, we're going to start with our champions. Senators Trudeau and Dhingra were incredible in the Senate Law and Justice Committee. Senator Dhingra is the chair of that committee. Senator Trudeau is the vice chair, co-chair, vice chair.
Yes, vice chair.
And it is a pleasure to watch them in that committee. They were incredibly strong champions. They shut down a lot of inappropriate comments, and they did a really good job speaking in favor of many of our bills. A lot of the reproductive rights bills went through their committee. Representatives Hansen, Slatter, and Ty were also key champions in the House, particularly around My Health, My Data, the SHIELD law, and healthcare equity for immigrants. And in general, most of the legislators showed up in strong support of these Repro Freedom package this session, and really ensured that we had such a strong passage of all of these bills. Legal Voice, what we did specifically is that we met with all of these lawmakers. We strategized on policy development with other key organizations working on these bills. We informed community members, and we created talking points and materials. So to ensure that the reproductive justice angle was met when we talked about the impact of these bills and why we needed them. So talking about how something like the My Health, My Data bill would impact organizations like crisis pregnancy centers, which are not subject to HIPAA most of the time, and would now, under this law, be required to obtain affirmative consent before selling or sharing client or patient information.
And just in case you're wondering who we're referring to, so in the photo that's up, the two women in the back there, on the left, my left, I guess, is Senator Dhingra, and then to the right, in the white blazer, is Senator Trudeau.
Seriously, I don't know if y'all are TVW nerds out there, but if you are, tune into a Senate Law and Justice Committee hearing. Next slide, please. So some of our key challenges, as Yvette alluded to, the Keep Our Care Act did not pass. It had opposition from a lot of different groups, a lot from major hospital associations. There was still a lot of work to be done on this bill as well, and we did not anticipate it to get as far as it did, and we're really grateful that it got as far as it did. And we're hopeful for changes to it next session that ensures that it will pass. The My Health, My Data bill did pass, but it faced a lot of opposition from business and industry. A lot of businesses were concerned that the bill was overbroad and that it impacted a lot of activity. However, I think we came to some good compromises, and the My Health, My Data bill is a strong bill that a strong law that does protect health privacy. It has, on the floor in the House and the Senate, had one of the largest number of amendments I've ever seen on a bill. And the House floor debate in particular was incredibly contentious. And finally, on the SHIELD law, this law actually passed fairly easily, but testimony was incredibly intense, and there was extreme transphobia in the public testimony. It was this bill and another bill that I think a lot of folks on the right coalesced around, with a framing of parental rights, which was both inaccurate and inflammatory, and then also extreme transphobia. So those were all really, it was a tough session because of that. But once again, we're grateful to our key champions for staying on message, for staying dedicated to this package of bills and passing them out of their different committees and on the floor. Next slide. I think this is it.
Oh, there we go. I think we had missed a slide. So this was our bill signing at the end of session for the entire reproductive freedom package minus the Keep Our Care Act. So you'll see on the left-hand side is all of the advocates, ACLU, Planned Parenthood, Pro-Choice Washington, who am I missing? Okay, I think that's good. And then on the left-hand side, my left is just Alizeh's and I's picture with our governor, Governor Inslee. All right, well, we're getting towards the end of our program here, but what does summer look like? It's really just implementation and education, tracking how our bills will be, just how the rulemaking on it is going to roll out. And so we'd really love to spend some time this summer to meet and strategize with stakeholders, community members. We'd also love to hear from you all on what you all believe should be the focus next year. We did get a good amount of work done this in 2023 session, but we couldn't accomplish everything. So just would really love to hear from you all, maybe in the chat, if the chat function is accessible. Here, just like, what are you all seeing as challenges in your community or with the population of folks that you all serve? With the context of all of the bills that Alizeh and I just went through. So I'll just leave it open a little bit to see what you all go ahead and put in the chat.
And meanwhile, in the interim, as Yvette said, we are still meeting with different community groups to form our priorities for next session. As I said earlier, Yvette and I started in December. So we did not have a chance to meet with impacted groups and develop a different policy agenda. And we're really excited to tackle that this session over the interim to ensure that the work we're doing reflects needs in the community. And also now is your opportunity, if you have any questions, to get those answered as well. I know we breezed through the bills fairly fast. And thank you to Jen for putting the links to all of the bills in the chat. We're happy to jump if you have more questions in depth on any of the different laws that were passed.
We did get one question on gender-affirming care, if that will continue. And so in reflection to that question is, as we continue to see the growing number of bans on abortion care, we see the similar thing happen for gender-affirming care, which also pushes people to travel to other states where you have better access to that care. And so just wanted to address that really quick for whomever asked that question, is that Washington does continue to be an access state for gender-affirming care, although there are always ways that we could be better. And we do continue to see an increase in people traveling from restrictive states to Washington to continue to get that care.
We've also gotten questions around the SHIELD law in terms of how many other states have one. As of today, there are 13 states total, plus Washington, D.C., that have SHIELD laws. And we will continue to see the impacts of restrictions on travel and other collateral consequences of the various abortion bans interacting with the SHIELD laws. We've talked to other folks before and really mentioned that we're in an unprecedented time. And a lot of the ways that the patchwork of laws across the country are going to impact providers and patients is still to be seen.
Thank you for that link in the chat, Jen. You could go ahead and go to the next slide. All right, we'll pass it back to Jen.
Thanks, y'all. Thank you so much, Alizeh and Yvette, for the super thorough presentation today. And we did just get a question, so I'm going to give you this question before we do wrap up for the day today. So the question is, do you have any sense of how law enforcement will react to the SHIELD law?
I don't. They were supportive to neutral about the SHIELD law during the session. So once again, I think it will just depend on how it plays out. What is helpful about the shield law is that there are multiple layers of protection. So for example, if there is an arrest warrant that comes from out of state for an in-state Washington healthcare provider, and the police don't notice, or law enforcement doesn't notice that it's about protected healthcare services and decides to execute the warrant, our court systems would then not process it. So there are multiple levels and layers of protection, and we hope that everyone will be very cognizant of the various protections and follow through on them, including law enforcement.
Great, thank you so much. That was the only question that came through. So with that, we're gonna go ahead and start wrapping up our presentation for today. As always, you can reach out to us to ask us any follow-up questions you may have. But for now, we're gonna leave you with a few different ways that you can connect with us to stay up to date, to get breaking news, and to get involved with Legal Voice and our fight across the Northwest, not just in Washington State, but also in Idaho, Montana, Oregon, and Alaska in the fight for justice and gender equity. One of the first things that you can go to is on May 16th, we'll be kicking off our Pints in Progress annual event series in Woodinville at Locust Cider, and every $1 from every cider sold is going to go towards Legal Voice as part of a fundraiser. So you can go ahead and join us there. Or you can join us in Seattle on May 22nd, where we'll be at Optimism Brewery as well. Just having staffers there available to answer any other questions, to get more into the weeds of the legislative session or of things that we have up and coming in terms of what our work looks like. The RSVP link is in the chat, so you can go ahead and let us know that you'll be joining us there. Additionally, you can follow us on social media, on Facebook, Instagram, and Twitter, if you'd like to see things as they're happening, or our analysis and take on different things that are occurring across the Northwest and the country. And you can also sign up for email updates from Legal Voice as well. And there's a plethora of items that you can choose what to get updates on. Do you want updates on our fundraisers and our events so that you can mingle with people again? Do you want to donate to us? Do you only want breaking news? Do you only want legislative information for Washington? Do you want all of the legislative information? Do you want everything except legislative information? There's a variety of ways that you can sign up to get that knowledge from Legal Voice, and all of that is in the chat as well. We'll be following up with an email with these links and with information for you to stay connected to Legal Voice. And for folks who are looking for CLE credit for today, we'll also be following up with an email on what you need to provide in order for us to be able to get that for you. With that said, we are ready to close our webinar for today. Thank you so much for joining us. I hope you still get some time to enjoy the sun that we have gracing us today, and we hope you have a great weekend. Thank you so much.